Your answer will resonate so much better with your med school interviewers. It's November 11th, 2025, and if you're about to interview for medical school, do not mess up your response to the question, why medicine? First and most important thing I can tell you is not to memorize your answer. If you come off like you're reciting something and trying to be perfect, that is the easiest way to come off as disingenuous and insincere. Instead, my first piece of advice is that you actually understand that question for yourself. And that means reflecting not only on the question, why medicine, but how did you come to choose medicine, particularly against all other options? You want to help people? Why not become a philanthropist? You want to do things with your hands? Why not become a dentist? You want to sit with people in suffering? Why not be a nurse at the bedside? All of these different professions add irreplaceable value to the care of patients. You're choosing one out of them. Why that one and not the others? You also want to be aware and be able to express how you came to that conviction. What were the core experiences that led you to conclude that this is the work you want to be doing? The personal, the professional, and the experiences that perhaps didn't convince you that medicine is it, but that other compelling alternatives are not it. Very importantly, you want to make sure you mention why your conviction matters to other people. In other words, what does it mean to you to help people? Some of the most evil people in human history probably got out of bed in the morning thinking, I'm going to make a change in the world, I'm going to help humanity. And then they go on to perpetuate genocide and terrible things. Well, you have to define what helping humanity means to you. I'm giving you that extreme example because it's really important. When you say things like, I want to help people, it's actually meaningless until you define what that actually looks like. Once you have all of those things churning in your head, you'll be able to talk about it fluidly. And that brings us to the next class of things you should be practicing, which is your conversational skills. Learning to pause, learning to articulate. When you do pause, learning to sequence that space between A, the question you're being asked, and B, the response you want to give. And sometimes B prime or B double prime or even C being things that are just slightly beyond the question that you feel will answer it better, but not D, E, F, and Q, because you don't just want to start rambling and obfuscating the core meanings of your response behind the verbosity and breadth of your answer. Learning how to breathe in a way that calms your nerves, particularly in the high-stakes interview setting. Learning how to gesticulate, free up your upper body so that there are some nonverbal cues coming across. Learning how to give nonverbal reactions to things, smiling, shrugging, chuckling. These things are not things you can feign successfully. You have to actually practice conversation, not over Zoom, not over TikTok, but actually in person, being with somebody and learning to develop those skills. Because what we're looking for people applying to medical school is people who actually masterfully are able to be in the space with other human beings. The only thing for it is practice, and that can come through any experience that you're having. It'll come a lot better and more effectively if you are consciously trying to develop that skill, trying to develop the ability to communicate in an effective and clear way. If you just shift your thinking around the question, why medicine,